Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Anthony Matt.
Today on Medical Insight, we're exploring the difference between the neonatal intensive care unit, or NICU, and the pediatric intensive care unit, or PICU, and what care both has to offer. While staff in both departments care for some of our youngest patients, there are some important distinctions to make.
So in the pediatric ICU, we'll take care of everybody from usually around a month of age up until age 18. In the neonatal ICU, they will take care of patients from birth up until the patient is ready to go home.
Most of the time, babies who are admitted to the NICU are born prematurely, have a low birth weight, or are born with a medical condition that requires special care immediately following birth. The PICU is designed more for any child who is seriously ill and needs intensive care.
The best way to explain why we have two would be the issues in those early days of life are so complex and require a lot of dedicated attention to make sure that these fragile patients have their best start at life. In the pediatric ICU, we are prepared to handle any number of illnesses, injuries, problems that come from infancy to adulthood. And it's important to keep those separate so that maybe an infection or a problem that we deal with on the pediatric side doesn't become a problem in our neonatal patients who are so fresh to this world.
And in some cases, your child may fit into either the NICU or the PICU.
That patient, we will sort of decide what the best place is. Is it the neonatal ICU or is it the pediatric ICU? We all work really well together to make sure that these kids get the best care they can.
Essentia is the only hospital in the region to offer both a NICU and a PICU.
To learn more about this or other health topics, visit essentiahealth.org/medicalinsight.